And it's so great to have you here. Many of us know that medicine is an integral part of the new Peoria economy. Thank you for coming.
Thank you.
And over here so I can see as many people, otherwise I feel like I'm sort of performing in the round there. I'm not sure if I'm as excited as liquor and speed bumps, but we'll see what I can do here. So I'm going to talk a little bit about the college and just start with an overview of what we do, then talk about medical student education, a little bit about physician, resident, fellow training, some of the campus innovations we've had, and then talk about community impact. So the College of Medicine, University of Illinois College of Medicine, Peoria, is part of the largest public medical school in the United States, which is the University of Illinois College of Medicine, located with the primary campus in Chicago. We're now educating over 240 medical students each year across all 4 years. As Councilman Gray mentioned, we've now become a 4-year school, a dream of many deans before me that actually came to fruition. Training now about 300 physician residents and fellows. So you do 4 years of medical school, at least 3 years of residency, and then you do fellowship. So that's the process: undergraduate college degree, medical school, residency, then fellowship, in partnership with OSF Healthcare and Unity Point Health. We have about 160 full-time faculty and almost 1,200 part-time and non-salaried faculty. Annual budget for the school is about $72 million, and we do research focused primarily on cancer, neurosciences, educational research, particularly using simulation and health outcomes. So in 2017, we implemented big changes. We added first-year medical students. In the past, our medical students spent their first year in Urbana and then came to Peoria. We've also grown our class size. We traditionally have been around 50, and now we have 67 in our current first-year class. We had to hire the necessary faculty and staff to teach the new M1, so about 12 new faculty and staff, all of them brought to Central Illinois, and spent over $3 million in renovations for our new laboratory space, student spaces, and a virtual reality lab, which I'm going to talk about a little more later. We also have all of our Peoria students in what we call early clinical immersion. We want them to be excellent doctors, have great communication skills, and so our physicians, our students are now going into a doctor's office in their first year. So if you see someone in a short white coat with that little badge on their arm, they're probably one of mine, and they really enjoy the opportunity to talk to patients. We have 2 active programs trying to address underserved communities. One of those is the Rural Student Physician Program. Our rural areas are very grossly underserved with doctors, and this is a special program in the 3rd year that sends students out to rural communities for a period of 7 months, where they really embed in those communities. And the second program is an urban health program. About 15 to 20% of the students in the class are generally from underrepresented minorities. And the goal is to train physicians that reflect the diversity of the communities that they serve. Currently, our incoming class is all state of Illinois residents. This has been a real active move by the campus to try and be sure that we recruit as much as we can people who are both qualified and ideally from Illinois, and even more ideally from downstate Illinois, since people tend to stay in the types of communities they grew up in. If you talk about physician residents, so when you finish med school, you go into residency. There are about 300 residents and fellows now in the Peoria community, and that's almost 100 more than a decade ago. So all of those programs have expanded in the last decade. The university serves as the sponsor for those, but we do them in partnership with either OSF Healthcare St. Francis Medical Center, the Children's Hospital, or with Unity Point Methodist. So each year there are about 70 new residents that either stay in Peoria because they did their medical school here or move to Peoria to get advanced medical training. Fellowships then comes after residency. We've created 5 new ones in the last 5 years: cardiology, gastroenterology, the doctors who handle the stomach and bowel simulation, critical care, and hospice and palliative care, the individuals who help individuals who might need special care toward end of life or with chronic disease. We also are very proud to have started a psychiatry residency. It's our first new residency in 2011 because there are huge needs for additional mental health providers in the Peoria community and surrounding downstate. So nationwide, about 60% of physicians will practice in the state where they did their residency. So if you want to have doctors to support the healthcare economy, we need to be training them in Peoria and within the state of Illinois. Other things that we've done, in 2016, we purchased the land next to us, the former VA clinic, brought this building down. It's currently grass, and I don't have current plans for it. My dream, if I were queen of the world and had an infinite pocket, would be to build a women's and children's clinic there to serve that particular area, but those resources don't yet exist, but still on my radar screen. We're fundraising to continue our building renovations, as there are still areas that we've not updated since the building was built. I want to talk a little bit about our collaborations with JUMP. JUMP Trading is the large simulation center, one of the largest in the world, one of perhaps the top 5. We work with them, and the idea is they create new and innovative technologies, but then those technologies need to be tested and curriculum developed for them that's usable at the student level for us to do education. And so the pipeline thoughts are that we take new ideas that might be developed at JUMP or new equipment, we test them at the medical school to figure out how effective they are at education, pilot them, write them up in journal articles, and then ideally they will develop spin-off companies for the future that will use that technology to teach not only medical students, which is a limited population, but teaching in general. We believe that we have the largest virtual reality lab in a medical school in the United States currently as part of our campus, as part of this effort to be innovative in our education. So the goal then, as I said, is to take it, measure it, and see if it's effective. We're going to switch a little bit, talk more about community impact. You know, why does it matter to you that you have a medical school in Peoria? Well, according to our EDC, healthcare is about 18% of the Peoria economy, and it's growing. So it's a critically important thing for the economy. So when you have a medical school, you want to not be sure that the care that you're getting is the best that you can get. You know, it's so good. People don't appreciate that you really have excellent medical care here and wonderful opportunities to get care personally. But it also is a huge part of what is supporting our current economy. Healthcare surpassed Caterpillar in terms of being cumulatively the largest employers. However, healthcare depends on physicians as well as a wide range of other healthcare professionals, and we're expecting a significant physician shortage. And recruiting to Peoria is not always the easiest thing. We don't have downhill skiing. We don't have an ocean. And so it's really important to train our own. So our students, our residents, our fellows are tomorrow's physicians for Peoria, for Central Illinois, for our economy. Other impacts, our students are very active in the community. We have a long-standing, I think over 20-year program with Manual High School. That's a student enrichment program to interest students at Manual in STEM careers, sciences. We have the Guides program with Quest Charter Academy, again, interesting younger people in the sciences. Our residents and faculty work at the free clinic, the Cordoba Health Clinic. Loaves and Fishes they work at. We've given cognitively based compassion training sort of across the community to teaching police and others, which is a way of helping to manage stresses. And so we're really embedded in the community we serve. We also do a lot of direct patient care, and that's an important contribution, particularly the Children's Hospital. Many of the subspecialists there are university employed. We do community education. You'll see our ads periodically in the paper. If you count, we have an impact of our employment with the $72 million budget, and over 1,000 candidates come to Peoria each year to interview for the positions I talked about, student residents and fellows. Plus, being able to work with a medical school makes physicians much more likely to pick Peoria to practice. So particularly for those very competitive disciplines, when people are figuring out where they want to practice, they look at Peoria and say, oh, Peoria has a medical school. I'll have an opportunity to teach. I might have an opportunity to do research. I'll be able to work with fellows. This is critically important to our ability to have the kind of cutting-edge medical care that Peoria should be proud to have. Finally, an opportunity that's not realized yet, but is sort of on the things to think about is President Killeen, as part of the University of Illinois system, is trying to figure out how do you leverage the strength of the entire university, not just the medical school, not just UIC, but all of the University of Illinois system, in order to support economic development. And so although the medical school has a lot to offer and can do a great deal, the larger question of how do we figure out how to link with the other resources of the University of Illinois is an important one to look at as we try to figure out how to expand the economy in Peoria. And there is work that's ongoing in that area to figure out how to strengthen that.